John is now utilizing his morals to help him to kind of balance those negative ideas that he has about himself. So what the ego tries to do is to kind of create that balance of utilizing your morals and trying to help uh, positive, adaptive ways for him to kind of figure out what's the best way for him to solve his problems with his academic failings. So what it would do is, instead of focusing on the negative ideation, he would begin to develop more positive ideation towards himself. With this model, solution focused therapy, what I do like about this therapy, and I probably would use it in my private practice, I would use it more so for event triggered depression. Um, Not so much long term chronic depression. So, for example, John has never had episodes of depression before. This was his first suicide attempt. This is the first time he's reporting suicidal ideation, um, and extreme anxiety. So in a situation like this, solution focused therapy is would be an effective tool, because we can focus on John and I can focus on ways to maybe better his study habits, focus on his strengths, and figure out solutions to his problems. A critique of this therapy, however, if a patient has more of a chronic depression and there are other things that are triggering depression, so it could be with Humanistic, we're looking at the whole person. So we're looking at other triggers that could possibly cause the anxiety or cause the depression, um, different things that could have happened over the life course trajectory. So in the case with John, if he had more of a chronic depression, and it was more it was not only inclusive of him failing academically, but also stemming from somewhere else. Just for an example, if his father is not around, then that could be, affecting him negatively, and maybe um, a knock to his confidence in himself because his father is not around. Well, SFT would not allow me as the clinician to review that with John, because we're only solely focused on the current problem. So it's limiting in that aspect for long term therapy. But again, John is only presenting with this first time of having, attempting suicide and having suicidal ideation, is solely based, from what he's saying, is solely based from failing this year in school. This is the first time he has failed. So, for any student who does exceptionally well, and for them to fail, that's a big hit to their ego. So, it just makes sense. It's logical that John is kind of down on himself right now. But with solution focused therapy, um, in addition, in a combination with the group therapy sessions, the other interventions that are taking place within the hospital setting, um, John will begin to not only gather more energy um, from the boost in his mood, but he will also learn different strategies and better habits, as far as um, focusing on his strengths and realizing that he is a good student. Overall, he's a great student. He just is experiencing a hardship, because with high school it comes with more challenges. So he has to learn how to figure out those challenges for himself. And what solution focused therapy will do is to help him to see the scope of things differently. Whereas in middle school, school came easier to John. He probably didn't have to study. He probably could do his homework at the last minute and get all A's. But with high school, he has more research papers, and the math is harder, and the science is harder. So now he has to redevelop strategies to help him learn how to study better. And also, whereas he may not have needed a tutor or extra help from his teachers, or bounce ideas off of other students, he will now be able to learn how to develop new habits where he is utilizing all of his available resources. And with solution focused therapy, John will increase upon his mood and increase upon his confidence, and no doubt will become a better student. This is Sarah Washington reviewing Module 1 for Humanistic Perspective.